Good morning. I know people are still entering, but I want to welcome you. I'm Olivia Golden, the Executive Director of the Center for Law and Social Policy, or CLASP, and I'm thrilled to welcome you to this extraordinary panel called Childcare, the American Rescue Plan and Beyond. If you choose to share on social media, please use the hashtag #ChildcareBeyond. There couldn't be a more important and timely topic than this one. And we wanted to let you know that in case there's anything more you want to follow up on afterwards, we are recording the panel and it will be available on the CLASP website after the event. After a brief video that we'll be sharing in a moment, I'm going to turn the panel over to our extraordinary moderator, Catherine Rampell. Catherine is an opinion columnist at the Washington Post. She brings to her work a thoughtfulness, deep care, and a commitment to children and families that I deeply admire. And she's also a commentator for CNN, a special correspondent for the PBS NewsHour, and a contributor to Marketplace, an extraordinary resume. And now, before turning it over to Catherine, I'm thrilled to open the discussion with a brief video remarks from Representative Lois Frankel of Florida, a long-term champion of childcare.
Hello, everyone. I'm Lois Frankel, member of Congress from South Florida, and I'm one of the co-chairs of the Democratic Women's Caucus. Let me start by saying thank you to CLASP for inviting me to be with you today, and thank you for your very important mission of advancing policy solutions for people with low incomes. And a shout out to your moderator, Catherine Rampell, who is not only a very, very thoughtful columnist for the Washington Post, but her parents are constituents and longtime friends here in Palm Beach. So I've been asked to give the congressional view of the American Rescue Plan's investment in childcare. And let me preface my remarks to say that back in the day, I was a working mother, and today, actually, I'm a working grandmother whose grandchildren have two working parents. Finding a safe, affordable childcare was a challenge before COVID pandemic, and now it's even more difficult. It's difficult for parents, providers, and their staff. And I've heard from childcare providers across the state of Florida who don't know how they'll keep their staff employed and their doors open, and Florida's not alone. This is a national problem. The Bipartisan Policy Center found that 60% of licensed childcare providers had to close or reduce their hours during COVID. And that means an estimated 4.5 million childcare slots could be permanently lost. And we know this disproportionately impacts women. According to the US Census Bureau, women are 3 times more likely than men not to work due to childcare demands. And women, especially women of color, are the ones who make up the majority of childcare providers and the childcare workforce, and are therefore have lost their jobs or risk of losing their jobs. And sadly, these are very important jobs to all of us, and they don't pay well. So I'm going to start here with a little good news, and that is the American Rescue Plan, which is very critical to funding to stabilize the childcare industry. An investment of $15 billion for the Child Care and Development Block Grant to help families pay for childcare, $1 billion for Head Start, and $24 billion for a stabilization fund to assist providers with the resources to safely stay open. Buy the necessary resources, hire more staff. And this is an historic investment in childcare in our country. However, we know we need much more, in the words of our president, to build back better. Safe, affordable childcare was out of reach for too many families before the pandemic, and roughly 1/3 of poor families were pushed into poverty by childcare expenses, and far too many providers were making poverty wages. with the rate of poverty among childcare workers often being more than twice the rate of poverty among women workers overall. We made investments in quality childcare, Head Start, and universal pre-K for 3 and 4-year-olds. But listen, investments in childcare is not only good for children's outcome, but for women entering and staying in the workforce. It's adding to our economy, and we can't afford to put this off any longer. The American Rescue Plan is a good step forward, but we must do more to ensure that Americans get back to good jobs that allow them to take care of themselves and their families. And that's why the Democratic Women's Caucus takes the position that moms are not getting on the new roads if they don't have a safe, nurturing place for their child. So as we move forward with our new infrastructure bills, our child care asks are simple. Families should not pay more than 7% of their income on child care. Child care workers should be paid living wages and equitable wages compared to educators with similar credentials. Care should be available to all children under the age of 13 and for older children with disabilities. And resources should be available to child care providers to repair and modernize their workplace. So thank you, CLASP, for hosting this event and allowing me to participate. I expect your excellent panel will add much to this discussion. Everybody stay safe and have a great day.
So thanks everyone for joining us today. I am Catherine Rampell. I'm an opinion columnist at the Washington Post. I'm sorry to say that one of our panelists will not be joining us today. Rohini Kosolu from the Vice President's office got called into an important meeting, so she won't be able to participate. But we still have a very esteemed panel, so I look forward to hearing their remarks. As many of our audience members likely know, for more than 40 years, the majority of American women have been in the workforce, which is another way of saying that for at least 40 years, the child care system in the United States has largely been failing American women and, for that matter, American men. And it's not as if this was some hidden issue we didn't know about 40 years ago. If you think back to the hit movie 9 to 5, which came out in 1980, it depicted on-site childcare as something working women were desperate for. So this is an issue that's been in pop culture and policy circles for quite a while. And there has been progress, of course, over this time period. There have been flashpoints where it looked like we were finally on the verge of getting something closer to affordable, reliable, high quality childcare, at least for some populations, maybe universally. We had the creation of the Child Care and Development Block Grant, Early Head Start 4 years ago. There was also renewed Republican interest in childcare support, including from some high profile people like Ivanka Trump and Republican senators. And it looked like there was a moment for bipartisan progress. The public was on board, politicians were on board, and then, of course, things stalled again. One more time around, we look like we have reasons to be optimistic about this issue. For example, as you've just heard, the American Rescue Plan allocated funds that represent the biggest investment in childcare since World War II. President Biden has indicated that he is interested in appropriating more funds for this issue in the forthcoming American Families Plan. And for various reasons over the past year, the issue has perhaps become more politically salient for the American public. We've seen what it looks like when how well an economy can function when schools and childcare facilities close, and what kind of setback that represents both for children and for working parents, particularly working women of color. So I'm delighted to introduce our panelists today. They include Secretary Grace Ho, who has served under Governor Pritzker as the Secretary of the State of Illinois Department of Human Services since March 2019. Her department oversees a number of social services programs, including those related to mental health, substance use prevention, developmental disabilities, and family and community services, including, of course, childcare issues. We are also joined by Mary Ignatius, who is a statewide organizer for Parent Voices in California. This organization rather is a grassroots organizing effort that fights to make childcare more accessible and affordable for all families. She served in the role for many years, I think since 2005, if I remember correctly. And she has helped through her organization expand access to childcare in the state, and so can hopefully share some lessons that would be applicable for other states and other communities and the federal government about how to make progress here. And then finally, Olivia Golden, who I'm guessing most of our audience knows. She is CLASP's executive director. She's an expert in child and family programs at the federal, state, and local levels. She's advised, she and her colleagues at CLASP have advised nonprofits and all levels of government on issues related to low-income children and families. During the Clinton administration, she served as the Commissioner for Children, Youth, and Families, and then as Assistant Secretary for Children and Families at HHS. And she was a key player in expanding and improving Head Start and creating early Head Start, among other achievements related to our subject of the day. So before I begin the discussion with our panelists, I would like to let you know that we are taking Q&A submitted from our audience. You can put your questions in the Q&A feature as you listen, and we'll get to them towards the end and do as many as time permits. So thanks again to our panelists. My first question to you is sort of about the premise for this panel. As I said, it seems like we are in a different place today in the national conversation about childcare than at any time, perhaps, in US history. Do you agree with that? If so, why do you think that is? And what are your kind of top line recommendations for keeping the interest and momentum in this issue going? Olivia, why don't we start with you?
Thank you. Thank you, Catherine, and thank you to everybody on this incredible panel. So yes, I completely agree. I think this is an extraordinary moment. As you said, it's been 40 years that women, including mothers with young children, have been entering the labor force. And I've been involved with this issue for many of those years, and still remember in the 1990s when we created the Child Care and Development Block Grant, being shocked that it had taken so long to recognize or to start to recognize the crucial importance of childcare. And then I've continued to be shocked in the 30 years since that it's stayed on the sidelines. And I do think that now it is front and center. I think, as you said, and as the representative said in her initial remarks, having $39 billion to repair the damage of the pandemic and the American Rescue Plan is just an entirely different scale from what we've ever committed to childcare before. On the why, I'd highlight three things quickly. There's been, for a number of years, extraordinary organizing and advocacy, and it's been built on an insight, which I think Mary's work exemplifies, but it's also been elsewhere, to connect the parents and the people who work in childcare, to think of organizing on behalf of all of those people, largely women, disproportionately women of color, and connect across on themes of economic and racial justice. And it's interesting, in the early years, we always thought that talking about children would be the way to get there, but for whatever reason, although the benefits are incredible for children, that's not what's worked. The second thing is the change in who's voting and who's got political power. I do think women in Congress have mattered a lot. And then the third thing is the culminating event of the pandemic, as with so many other issues that just really illustrated the disparities and showed us, in this case, that a world without childcare is a devastating world. It destroys women's labor force participation, families' economic security, and it's deeply damaging to people of color in particular. So I'll just say what's next at a very top line level, because I want to hear from everybody else. I think we have to use the $39 billion incredibly effectively and powerfully in a way that makes a difference in people's lives. That will keep the momentum going. We have to keep the big goals in our mind and move on those at the same time, change childcare system. And I think keeping parents, providers, women of color front and center, both in decision-making and in telling the stories in a powerful and convincing way.
Secretary Ho, what are your thoughts?
Well, so good morning, everyone. It's such a pleasure to be here with you, and thanks for having me, Olivia, and the CLASP team. Yes, this is absolutely a different, a new, and monumental time. And I would say, unfortunately, there's probably been too many different moments for childcare in the human services system over the past many decades. And I think one of the things that we need to do is not only to build upon this opportunity, but to even out the experiences and the ebb and flow of how we resource and how we value human services, including childcare. You know, I think there are a lot of factors that got us to where we are. History, I agree with Olivia. COVID laying bare to the inequities that we knew existed. Government at the federal and state level that I believe now is responsive, compassionate, practical, responsible. Government that looks and feels like the people that we serve. We in government need to have people who have experienced poverty, struggle, racism in order to rectify it. And I absolutely agree. Parents, organizers, advocates fighting for what's right. We've experienced so much whiplash, right? And a pendulum swing on the federal and the state level. You know, when I walked in March of 2019, the state of Illinois had been battered and our human services system was probably the biggest victim. No state budget for 2 years, deep cuts. And when I walked in, we had to rebuild everything: trust, quality of services, timeliness, accuracy, and I think our reputation. And so while we're here to talk about childcare, I do come at this work from a holistic approach, the entire person, the entire family, entire communities, right? Human services is not just one thing. You know, chances are if you are eligible for childcare assistance, you may also need SNAP. You may also benefit from PEBT, Medicaid, housing supports, after school programs, et cetera. And so government can't just be good at one thing. And so that has been a value of ours and something that we've been moving forward. And I want to give you one example of what I think strong leadership and a commitment to community does. Right, so we are in the process of piloting a vaccine administration program where our caseworkers, right, in one of our local offices, when they're making phone calls regarding SNAP, Medicaid, or food stamps, we ask them if they would like to have access to a vaccine. And then that caseworker has been making appointments for our customers to get vaccine. It has been an extremely effective pilot, and we're looking to build upon that. And so, you know, when I think about our response to COVID-19, we have had to do the impossible. And I think one of the challenges, right, of government and government funded programs is, unfortunately, we always have to be pushing against the negative, inaccurate, sometimes stereotypes of government. Like, we are judged wholly almost by our mistakes and calculations instead of actually what we are able to accomplish, right, in sound government. I think we're also coming to an increased recognition of why communities, predominantly Black and Brown communities, struggle. You know, understanding systems, history, and policies. And the COVID impact revealed what all of us have really known to be present, which are deep inequities. And to right them requires a dramatic shift in significant investments, right? Pandemic was proof. People are the victim of policies, practices that we created over many, many years, and in fact, centuries. And so I think as we move forward, right, we need to continue to recognize the importance of sound government, right? To make sure that our programs are leadership proof, which I think is hard. It matters very, very much who's in the White House. It matters very, very much who's in the governor's seat. And is that fair, right, to have this pendulum swinging for our families? And how do we make that? How do we create more permanency? And so I think as we move forward, we want to take advantage of these amazing federal resources to recover, evolve, strengthen, and grow our services in a more permanent way. We need to look at research and data, and we need to continue to invest in families, community organizing, and advocacy, because there is much more permanence in those leaderships than there is anywhere else. And I want to close by also saying that, you know, in Illinois, we recently launched a racial healing initiative called Healing Illinois. And we launched this right in the middle of the pandemic last year. You know, the hurt and the anguish of the pandemic and the hurt and anguish over the police killing of George Floyd, we knew that this moment called for this, right? So racial healing is not the answer, but we believe that it is part of the answer. We can't just offer services and programs, but we also need to offer our communities a space for healing and telling their stories so that we can learn from it and build upon that.
Thank you, Secretary Ho. Mary, what are your thoughts on kind of top line recommendations for moving forward?
Yeah, I mean, just to build off the theme of 40 years ago, I think the other piece of context that also happened 40 years ago was the birth of the welfare queen stereotype, and how we've seen that permeate childcare policies and TANF policies. And it's that racist, sexist, classist trope that conjures up, you know, the Black mother sitting on the couch, that we've seen how that stereotype has created a lot of harm, particularly for Black and other families of color. And so we have this, I believe, tremendous opportunity to finally create a system for families that actually is centered in their experiences and centered in their solutions, that finally brings healing to this system. And because these families were not there to design the system, we see that it was really designed to set them up to not succeed. Right? It was designed to serve the least amount of families. It was designed to serve them for as a short amount of time as possible. It was designed to charge them fees that they can't even afford, and just to get them off of services. And so the opportunity that the American Rescue Plan provides to sort of be that, you know, influx of funding that has been historically and woefully and inadequately underfunded for so long, gives us that opportunity to kind of rebuild and re-envision and reimagine what our system can be and how it can adapt to the needs of families today. And I really think that we have to acknowledge the Black Lives Matter movement in forcing all of us to really reflect on how racism shows up in every single system that is part of society. And so I think with the sort of confluence of the pandemic finally like showing the nation childcare is essential, right? So with that, with the influx of the $39 billion, with the BLM movement forcing us to recognize racism and then really center the experiences of those families who have been harmed the most in really identifying the solutions that are going to help them move towards economic security. And then, you know, the administration has made promises around long-term funding solutions. I think, you know, the one-time money is necessary and it's the sort of inoculation or vaccine we need in this moment. But like a flu shot, you need it every year. And so it can't just be one-time funding. It has to be sustained long-term funding over the long haul. And so I do feel like we are finally in the sweet spot of all of those pieces coming together. And from the perspective of our members, you know, it's increasing access to affordable childcare, and that when we start to charge families a contribution, it's really when they can afford it. What we've seen are families who are working paycheck to paycheck, and the $200 a month they may be paying towards their childcare, which to anyone listening, $200 a month for full-time childcare may sound like a huge deal. But if you're working paycheck to paycheck and you're deciding between paying your childcare fee or your electricity, it doesn't feel like a good choice. And so we have an opportunity with funding to make those childcare subsidies affordable. We have the opportunity to expand access to families, especially what we've seen of the need to ensure essential workers have affordable childcare. For many years, those essential workers have been on waiting lists, languishing, waiting for childcare, but because of historic underfunding, have never received it. And we have the opportunity to finally pay our childcare providers, who are predominantly BIPOC women, dignified wages and treat them as the brain architects they are, instead of giving them these poverty wages. And really, I think, pretending that their love is going to be enough to pay the bills. And it's just not enough. We have to pay them dignity wages. And so I think those are the steps in the right direction. And of course, making sure that the way we, our eligibility policies to qualify for childcare, that they are easy, simple, and that we trust families. We stop this criminalizing and monitoring, and really focus on what do families need, trust their choices, and give them uninterrupted, stable, reliable childcare for a minimum of a year, and really watch their children develop over the course of from birth to 13 years old. So I'll stop there around recommendations.
Great. Those are some great high-level thoughts. Olivia, you worked on, you were a federal policymaker on a number of these issues in the 90s. What do you think the lessons are from your experience then, based on your successes and the limitations of the programs that you created? What are the lessons for thinking about building out the infrastructure of childcare today?
That's interesting. And I think listening to this conversation, looking at a couple of the questions, is making me think of a bunch of lessons. So I think one lesson is we made a start on seeing how central racial justice was. And that was particularly in the Head Start and early Head Start context. Head Start comes out of the civil rights movement and has all kinds of lessons about, parents in control and communities of color. But I would say we failed at that in other ways. I was thinking about the fact that I commented about women with young children entering the labor force sort of most dramatically starting in the 80s. But of course, women of color, particularly Black women, have been working with young children for much longer. And the system's been built first in slavery and then since on their unpaid and inadequately compensated care. So I would say there are lessons now about how to place racial equity front and center, and we only did part of that. At a practical level, I would say a huge lesson for me is that you've got to have a great deal of federal state interaction to make something big happen. And I noticed in the Q&As, there's somebody asking about a state much less eager to do the right thing than either Secretary Ho's Illinois or the California advocacy Mary's been doing. And, the federal government has both authority, but also the ability to push, to make it easier, to convey information. So I just think you've got to have an active presence at the federal and state level. Just one example that we're pushing for right now is that quick guidance from the federal government with immediate things states need to get going, and then much more intensive guidance later, because you get myths in states. The state fiscal people tell you can't do X because the feds won't allow it, and it isn't true. And the only way to fix that is to move quickly. So that's the second lesson. And then the third one, I think, is when you have the chance to go big, you should do it, which is partly why I feel so strongly about implementing this money fully and building the base at the same time for the next step. I mean, creating Early Head Start was one of the most powerful experiences of my life, but it's still, somebody watching will know the exact number. I think it's serving something close to 100,000 babies, toddlers, and their families, but not the more than 1 million, several million that need it. And we got as far as we could, and then we've had 30 years stop. So I think those lessons, really centering racial and economic justice while broadening to everybody, having an active federal and state engagement with each other, and going as big as you can. And maybe just one more thing, exemplified by having Secretary Ho on the panel and having the Vice President's policy advisor try her best to get here. Having that kind of high level interest is essential. Childcare for too long has been located multiple levels down, which means that even the most well-meaning and passionate public officials can't get the support they need to actually deliver on a big agenda, and that's really crucial.
Secretary Ho, could you talk a little bit about what you think states need at this point? I mean, there's one of the themes I think of the discussion so far has been about some greater reliability of funding. Maybe you could talk about that. But what other kind of support do states that are interested, in particular, in building out childcare services need from the federal government or from other sources of leadership, NGOs or otherwise?
Yes, I think one of the things that we are all probably trying to figure out together in different states and across the country is what is the landscape of the need? What will it look like post-COVID, right? A great percentage of the workforce has gone remote, but we know that many of the families who are served by our program, our child care assistance program, may not have had that choice available to them. And so one of the things that we're trying to figure out is like, how do we proceed and advance in learning using data and research to help craft what the future state of childcare needs to be, number one. And I think number two is continue to allow us the flexibilities of figuring out what this new system needs to look like. I think that there are a great number of opportunities that we will be able to have to make sure that our providers are stabilized. We've used our first tranches of funding to make sure that our providers continue to stay open, to be able to retain their employees. But I think that we are going to need, space for innovation. And I think what Mary had also mentioned in her initial comments is that we need this shot in the arm, and we are going to take this shot in the arm for the next couple of years. But we also need to have time to analyze what worked, what didn't work, and then to be able to rely on funding into the future. And I think the other piece of it is coordination, right? People aren't only one thing. And so how do we make sure that families have access to the other array of supports and that there is fluidity and smoothness between the childcare system and the Medicaid system and the housing system? That, you find yourself when you're a family in crisis, and if you need a variety of systems and supports, it's almost sometimes like a treasure hunt. And it's not all the responsibility of the federal government. It's also our responsibility as a state to make it as easy as possible. But I think if we have a shared commitment on the federal as well as the state level to create, this mythical open door or no wrong door for public benefits, that it will actually create more opportunity and choice and future independence, right? And for the ability for families to thrive into the future. Is like, how can we make it an easier path for families? And so we would welcome those opportunities to talk about what fluidity and what coordination looks like within the state, with federal partners, and between programs.
Mary, you've had some successes already in the state of California in your tenure as a parent advocate. Could you talk a little bit about what those successes have been and what lessons they might hold for people interested in this issue in other states?
Yeah. Well, in California, we love to do radical things. And one of the most radical things we do is we bring parents who qualify for subsidized childcare into a room, and we ask them what would make the process simpler for you. What would remove the headaches? What would remove the stress? What would make it just easier for you to access services? And then when you get the golden ticket of qualifying and receiving a childcare subsidy, what do you need to keep it, right? So it's really that simple. I don't mean to be, cheeky about it, but that's really how we've been able to identify a lot of the policies that have created the most harm. And so starting in, I think it was 2017, we were able to establish 12-month authorizations for childcare assistance for the majority of childcare programs. Prior to that, if you were a parent working multiple part-time jobs while also going to school, you had to provide all of your pay stubs from all of your jobs from the previous 3 months. If you had a child with special needs, you had to go to the doctor and provide a form that showed that your child still had special needs. And you'd have to be on buses and go and actually just go talk to your employer over and over and over again about why you need subsidized childcare in order for you to show up to work. And it was those stories of those mothers and them bringing all 18 of their pay stubs to show, what it looks like, that we were able to start to talk about how this system is criminalizing families and making them feel unworthy and undeserving. And in those conversations, really talking about the need to restore trust in families and their ability to make decisions, the best decisions they can for their families, and for government and agencies to kind of get out of the way and not be fraud detectors and account forensics, it's just such a very odd culture we've created. And I think we've also taken away the joy of caseworkers helping families meet their needs. We've really hurt everybody who's been in the system. And so starting in 2017, it was, adding the 12-month authorizations. And then a year and a half later, we also looked at the TANF program and how families were entering TANF public assistance and childcare services. And what we were learning is that the system was like dangling childcare as like a carrot to meet the very arduous TANF cash assistance policies in order to meet welfare to work requirements. And so, you'd qualify for TANF, you'd have to go to a job club for 2 weeks, and then you get 2 weeks of childcare authorization. And then you go to a month of job training and learn how to do your resume. And then you get 4 weeks of childcare authorization. And you'd get this on and off of childcare authorization that left you without any licensed childcare options. And so in learning about how hard that was for families, we're able to shift it so that the moment you enter the TANF program, you get full-time childcare for a minimum of 12 months before you even have to meet a requirement within the welfare to work program. And so it really opened up licensed childcare options. It recognize that for some families who are surviving domestic violence or other mental health issues or substance abuse, that they too could get full-time childcare to meet those needs before forcing them into a job that they probably wouldn't be able to hold on to because of the trauma and other struggles. So I just think the biggest recommendation I have to folks is do the radical thing, bring families together. We can do it in a virtual space now, and just ask them what it is that hurts them the most. And right now our campaign is really around eliminating and waiving the co-payments, because we're seeing that harm and that struggle for families, along with the other things I mentioned. So
could I build on that, Catherine?
Please.
In two ways. One is eliminating the co-payments is definitely an easy thing for states to do, and an appropriate use of the emergency money at a time when people are in real economic difficulty. But the other point I wanted to make, Mary, which really underlines your point about figuring out where there are obstacles and hoops and barriers in the system, is that most of those obstacles and barriers and hoops in the system also harm the state agency in a bunch of ways. And you said that in terms of worker job satisfaction, but also one of the things we've learned in working with states is that states create errors for themselves by having really detailed policy. If you make people give you lots of forms and they forget one of them, then what you've got is something that you know, by your own policy is a mistake. If you make the process much simpler, which then the ARP envisions lots of breadth and flexibility. So where there are states on this, there are people from a lot of states on this call. What families advise you is often going to be way easier to implement. It's not only that it's way better for them. And when you're going to a big scale, when you're trying to expand, you really don't want a million detailed rules. It's like the vaccine rollout. You want to be able to go big.
Secretary Ho, so I wanted to pick up on some of the underlying themes of what's just been discussed that you and I have talked about before, which is how do you regain the trust of parents who have been let down by unreliable, unaffordable, perpetually rule-changing systems in the past? Even if you actually create a system that works for parents, how do you convince them that it works and sort of bring them back into enrollment of services that maybe they had bad experiences with before and now stand to gain from?
I would say that regaining trust has been probably the most significant challenge that we've had over the course of 2 years. And I think equal to that, equally important is to create the kind of high quality services that people depend on. And I think, you know, when we walked in the door, and this has a lot of, I think, bearing on all of the services that we provide at DHS, we were facing very, very serious backlogs as it relates to Medicaid. There were over 140,000 people who were waiting more than 45 days for a determination of their Medicaid eligibility in January of 2019, right? And so we were facing federal penalties, and I think similarly with SNAP, we were not experiencing very timeliness applications either. And so we worked very hard to reduce that backlog by over 90% over the past 2 years. And I use as an example because I think I think not only does it impact negatively people's ability to access health insurance, but it's a lack of dignity and respect that we had shown our customers, right? And I think that one of the other things that we're very well aware of is that some of the offices that, you know, the people who we serve have to enter are probably some of the most challenging offices in the state of Illinois. And so how do we create an experience where we are inviting them, right, to participate? How are we making them feel when they come in? And I think it was either Olivia or Mary talking about the experiences of caseworkers, right? Are they box checkers? Or are they actually a human to help them navigate through what might be the most challenging experiences of their life? And so I think that it's important for government to understand that how people feel when they're receiving services is critically important as to whether they're going to see it as a place that they can rely on, right? We are human services. And so we've had to try very, very hard to bring that human aspect back into our department. And it's not only through providing reliable quality services, but to listen and to care, and to not only listen, but then to adjust our policies after listening, right? And I think the other piece of it is that sounds extremely rudimentary is to do marketing and outreach. We want people to be in our programs, right? So our childcare program had been really decimated under the previous administration, and people, you know, when you're going to work, you have to have reliable childcare. That's just a basic. And if we can't provide that to you, then they're going to turn their back to us, right? And so we saw our roles decreasing very dramatically, right? The enrollment. And so we initiated a marketing program. We want people to participate in these very valuable services because we think it's not just a value to the families, but it's a value to the state. We want people to work, and we want them to be, rely on us in order to be in the workforce in a reliable way. And I think the other piece of regaining trust is that we need to look like the people we serve. We need to have experienced what many of our families go through as policy leaders, and we need to in many respects, ask for forgiveness for our failures. Whether I was sitting in this seat or not, I think I had to acknowledge, like, our system did not do right by you previously, and we are committed to doing better. Just honesty and forthrightness is what I think builds trust.
Mary, you mentioned earlier that one of the priorities for people who are interested in this issue should be paying higher wages to providers. Could you talk a little bit more about what the experience of the pandemic has been like for providers, and what you think still needs to, basically what you think the lessons are of the past year about structuring pay, structuring eligibility requirements for the people who work in these jobs, for example, what they currently look like now, and what more needs to be done to make these better jobs, essentially.
Yeah. Well, to any childcare providers who are listening, we are not worthy of the tremendous sacrifice you gave to the nation during this pandemic. And in many ways, you were abandoned to figure this out on your own. A lot of providers simply had to close. Hopefully those are temporary closures. And I think, again, the 39 billion is going to help reopen those. But for the providers who stayed open, especially family child care providers who had to adapt their programs in an instant and had to bring in lower their ratios and receive less funding, and then have all these new expenses around PPE equipment and sanitation. And, when the schools closed, they took on all these school-age children and had to purchase Wi-Fi and tables and chairs for big kids. And I mean, just you name it, they did it. And I just think we owe them a debt of gratitude, but they can't just be empty words. They have to be followed up with the action of restoring their trust and giving them the funding that they deserve. And so some of the things that a lot of states are doing is basing payment on enrollment and not attendance, which is huge because that's the only way these providers can really have a stable source of funding and make the adjustments that they need to make. And part of that is just restoring trust in them and recognizing that they know how to run their business, and they just need the flexibility and the funding to hire the staff, give the staff, hazard pay, pay for whatever equipment that they need. And so we just need to, again, restore trust and give them the funding to make the decisions that they need to make. And I think moving out of this, keeping the enrollment, paying based on enrollment, not attendance, really recognizing what the true cost of providing care is and making sure that the reimbursement rates that they receive are reflective of that, are reflective of the minimum wage, the minimum wages that need to be paid, but that, we really need to get to a place where we're not even paying minimum wage for early educators. There's no reason that they should not be making wages that allow them to not qualify for public assistance or Medicaid or food stamps. Like, they need to be earning salaries that are commensurate with just the incredible sacrifice and development they do for our kids.
So we have a lot of questions, great questions from our audience. Let's start with a couple here. So we have some questions about what our panelists think about eligibility guidelines. One person asks, what are some changes to eligibility guidelines that you would love to see removed from state or federal guidelines? Another person asks, is it possible to create incentives for states to move to presumptive eligibility measures that allow families better access to supports like SNAP, income supports, childcare assistance without jumping through multiple hoops barriers? Do any of you want to take that on?
Yeah, I think I'd give kind of a big picture answer. And I just want to encourage everybody to go on the CLASP website, look at our materials. My incredible colleagues do a lot of this work and do a lot of webinars and conversations on the specifics. What I would say is, right, the answer is yes, there's a lot you can do now. Yes, there's a lot you can do under ARP. And there should be more when we get to the next phase of childcare reform. So enrollment, not attendance, as Mary said, is a big deal. That means not having to go through lots of hoops. Continuity over a long period of time is really a big deal, not having to relook. It's worth noting that the set of responses to the pandemic in the American Rescue Plan and before that promote continuity in a lot of programs, which goes to Grace's point that if you can do it in lots of things, you're helping families the most. So for example, a year of Medicaid coverage postpartum is a huge deal, and states should be seizing that opportunity. So I guess what I would say is there's a lot there. There's especially a lot. The American Rescue Plan itself is very flexible. It has two pools. One of them is Child Care and Development Block Grant money, but intended to be available to help families and providers, including essential workers, whether or not they're eligible now. And then the Emergency Stabilization Fund piece, which is meant to help providers. So I would just say, and sort of Mary's point about ask families, ask providers, look at the data you've got about who's been hard hit. I know someone asked a question of how does this get to Black families? Well, states, I mean, that's who was hard hit. That's where it needs to go. And so I would say aim for as much flexibility as you can now along some of those lines, and then look for, as you're doing it, that builds the case for the next law to be much, much broader in terms of what it makes possible and allows.
So I would just add to that is that there, you know, we kind of see the utilization of the federal, this set of federal resources in two ways. One is how do we extend some of the supports that we already offered the system, including decreasing copays, as well as the child care restoration grants. So we pushed out 290 million in the first tranche, and we're getting ready to release another 160 million. And we were able to reach 70% of our child care centers in Illinois in that way. And I think these grants provide the flexibility to say, I need to use it here or here, right? Wages or PPE or additional costs. And then we were able to reach 44% of our homes. And so we're going to continue to do that. And in the meantime, we're also going to take a beat to say, what is the next set of thoughtful strategic investments that we need to make? How can we use this to evolve the system and to strengthen it over the long term? You know, we've struggled mightily over years to figure out how we can eliminate the cliff effect, right, in terms of eligibility for childcare. So how can we use this as a smoothing mechanism? And I think the other pieces of it that I think was embedded in the question is that how can we create a more holistic approach to providing supports to families? And so I think the other flexibilities within ARPA, which have to do with the rental assistance portion, is we're going to be utilizing that to fund community-based organizations to help with navigation, right? So you know, you may need housing supports, you may need rental supports, but we're trying to create case management aspects in the community, right? To say there are maybe other benefits that you could be eligible for. So to create a more seamless system within the community. Oftentimes people aren't coming to our offices at their lowest points, and we recognize that. They're going to our Illinois welcoming centers, or they're going to faith-based partners. And so we've actually also used these federal resources to think about other sorts of state partners, right? People who haven't been able to access state funds in the past. We've been able to create some new partners in that way, people who are closest to the ground and those who we're trying to reach.
We have a couple of questions also about whether the panelists have recommendations on the best uses of this funding from the American Rescue Plan, since it is relatively flexible. It can be used for staff, increased eligibility, and other things. What are the recommendations of our panelists about how to prioritize needs and how to deploy those funds?
I'll go. I mean, I think the beauty of this moment is that we don't have to pit the needs of the early educators against the needs of families. We have the opportunity, because of the amount of funding there is, to really be able to serve both at the same time. So in California, we're really focused on getting the reimbursement rates up to date, making sure there are grants to all providers, whether they're in a center, a family child care, an FFN provider, whether they're part of our subsidy program or not part of the subsidy program, really just recognizing the entire strength of our system and making sure everybody is lifted up. We are going to expand access to subsidies for families who have been waiting, especially when you look at the SHE session and the way the pandemic has impacted mothers' ability to work. And so really recognizing how important access to affordable childcare is going to be. As I mentioned, waiving the co-payments. We are adding funding in for facilities, professional development related to the mental health needs of our early educators who've really struggled during the pandemic, looking at trauma-informed care to address the needs of the children and families that are being served. We're also talking about funding. I think Secretary Ho kind of described being able to go into these communities and talk to families about the array of services that they qualify for, because maybe they won't get a childcare subsidy in this first round, but maybe they can get pandemic EBT, maybe they can get food stamps, maybe they can get TANF, maybe they can get rental assistance, and and to look at waiting list where there are families on waiting list and go to them first and do that sort of navigation and support. And one of the other things we're really hoping for is continue through the pandemic, like continued allowance for electronic, being able to turn in your paperwork electronically and via email and Zoom meetings, like the idea of having to go back to taking 3 buses to get to your appointment to recertify, like we can do better now. Yeah, so I'll stop there.
So we are almost out of time. We're supposed to wrap at noon Eastern. I'm just wondering if each of you wants to give a couple of sentences, very brief, about what you think success would look like several years from now, 5 years from now, let's say, if in fact we reach something that we would call success. Olivia, do you want to go?
Sure. So at the policy level, it would be something like one of the big pieces of legislation in Congress, like the Child Care for Working Families Act. All families have access at a price they can afford to high quality care. Early childhood educators are paid at a level commensurate with the incredible work they do and treated with dignity. I would add to that, I think that I've been thinking this whole panel about Secretary Ho's comment at the beginning of, can you leadership proof the policy? And my answer is no, you can't leadership proof it. But what you can do is have so many people benefit that it's inconceivable to roll it back, which I feel as though is where we're getting to, for example, on healthcare. So I would say it would be not only the policy and the law that would make me feel we'd succeeded in 3 or 4 or 5 years. It would be that even if we weren't finished implementing it, that a lot of people, particularly people of color, particularly providers and parents and children, were experiencing their lives really differently with the barriers torn down.
Mary, what are your thoughts? Again, brief.
Okay, so not to repeat anything that Olivia said, I think for me, 5 years from now, we would have, institutionalized parent engagement at the federal, state, and local level. And that would look like having grassroots councils of parents as well as early educators that are truly like, no policy gets out the door unless it's gone through those councils, to really understand and prevent those unintended consequences that happen when we don't talk to families and early educators. And so, we would have policies and practices that are truly transformative, that put trust back into families and really see thriving Black and Latina and Asian and immigrant and Indigenous and all families just thriving, and children being served 0 to 13 without interruption.
And Secretary Ho, you get the last word. What
So
does success look like?
So I would echo everything that Olivia and Mary had said, and then I would also emphasize that we have to take a real look, or that, let's see, that there would be fewer disparities amongst our families, and that the experiences for our Black and Brown communities would be closer to that of their white counterparts.
Thanks again to our great panelists and to the thoughtful questions from our audience. I'm sorry we didn't get to more of them, but I hope this panel was helpful. And yes, as I understand it, the recording will be available afterward if folks want to follow up.
Thank you.